Good afternoon and welcome. I'm Michael Pusillo, Chairman of the Palm Beach Civic Association, and it's my pleasure to welcome you to our Signature Series program today. As we are all aware, Palm Beach County has experienced a lot of transformation and a lot of growth. This growth includes changes in the all-important healthcare landscape. Cleveland Clinic, one of the nation's top medical care providers, is planning a dramatic expansion of its existing presence in Palm Beach County with a new 150-bed hospital in West Palm Beach. Today's keynote speakers, Dr. Tom Mihaljevic, President and CEO of Cleveland Clinic, and Dr. Conor Delaney, President of Cleveland Clinic, Florida, are here today to share the plans for this expansion and this new hospital in our community. We're also pleased to recognize other members of Cleveland Clinic's senior management team who are here with us today. Guy McClurkin, who is the Executive Director, Laura Kalifatis, Senior Vice President of Cleveland Clinic, and Jessica Gosa, Senior Director of their major gifts. We're honored to have you here today as our guests, and welcome. We're also pleased today, as we are at many of our Civic Association gatherings, to have some town officials. We have the mayor, Danielle Moore, Donnie, and I believe, do we have Council President Bobby Lindsay here? There we are, Bobby. Our outgoing Council President, and I see also Council Member Lou Crampton. And Council Member Ted Cooney. Do we have any other members of the council here? I don't believe so. Well, welcome and thank you for being here with us today. I also want to thank our sponsor for today's luncheon, Related Ross. They've been a partner and sponsor for many of our events, and we thank them again for their support of the Palm Beach Civic Association. I don't believe we have anyone from Related Ross here today. If we do, let me know. Okay. And I also want to give a shout out to the directors of the Civic Association, many of you who are here today. The directors are the backbone of our organization. You have been supportive of our organization in so many ways, and we thank you for your continued support each year and for your commitment to this organization and participation on our committees and as the extent to which you serve as ambassadors of our organization. Indeed, some have asked you, how can I help? You can help by continuing to be the good ambassadors you have been for our organization and spreading the word to others in our community of the important work that the Palm Beach Civic Association does and has been doing for 82 years in our community. So it's my pleasure to welcome you here today. Enjoy your lunch, and after we get started with lunch a bit further, Mary will introduce our speakers for the day. So welcome and thank you for being here with us today.
So great to see each of you here. I am Mary Robison, the CEO of the Palm Beach Civic Association, and what a wonderful program we have ahead that I know you will all enjoy. And being that the focus is on healthcare, I would like to first give a shout out to one of our standing committees. We at the Civic Association have 15 working standing committees, and one committee that is always at work is our healthcare committee, chaired by Judy Goodman. And Judy, would you please stand? And also, would members of the Healthcare Committee please stand? If you serve on the Healthcare Committee, would you please stand? These fine individuals give so much back to the Civic Association, and even more important, so much back to our community. We just released How to Eat Healthy, and it is a video through Vimeo that went through our subscriber list of 5,000 subscribers. So if you have not watched part 1, please do, because there's going to be a part 2 as well. So again, our thanks to our Healthcare Committee. Our speakers today, Dr. Thomas Mihaljevic, CEO and President of Cleveland Clinic, holder of the Morton L. Mandel CEO chair, and the name Morton Mandel certainly means a great deal to us in this town as well. And Dr. Conor Delaney, President of the Cleveland Clinic, Florida Market, But before I go any further, I'd like to take a moment to thank Leo and Catherine Vasilio for arranging this morning's or this afternoon's visit for our program. We thank you, Leo and Catherine. Leo is a member of our executive committee, co-chairman of our water committee, and a civic association director since 2013. And Catherine has been a civic association director since 2020. Leo and Catherine, again, we thank you so much for making this speaker series possible. So, back to Cleveland Clinic. Founded by 4 physicians in Cleveland, Ohio in 1921. Cleveland Clinic is a nonprofit medical center widely recognized for its integration of clinical care with research and education. Cleveland Clinic is consistently ranked one of the best hospitals in the United States. And Cleveland Clinic has had the presence in South Florida for more than 30 years. And that's Cleveland Clinic Weston is ranked as the number 1 hospital in the Miami-Fort Lauderdale metro area. And as we heard earlier, Cleveland Clinic is significantly expanding its patient care with plans for a new hospital and a larger outpatient care center in West Palm Beach. And today our 2 esteemed guest speakers are going to tell us certainly more about that. And Dr. Mihaljevic has led Cleveland Clinic and its 81,000 caregivers since January 2018. Under his guidance, Cleveland Clinic has grown substantially with more than 15 million patient encounters annually and yearly operating revenue of $15 billion. We also have Dr. Delaney with us, who is a colorectal surgeon who joined Cleveland Clinic in 1999. He has led Cleveland Clinic Florida's market since 2020. And he was the chairman of the Digestive Disease and Surgery Institute at Cleveland Clinic from 2015 to 2020, and is a past president of the American Society of Colon Rectal Surgeons. It is my pleasure. Please join me in welcoming our doctors. Thank you so much. Welcome. Thank you.
Thank you. Thank you very much for a kind introduction. And I know that Conor and I are delighted to be here and to share with you a little bit about Cleveland Clinic, about our plans here in Florida. But before I begin speaking about Cleveland Clinic, just a great thanks to Kathy and Leo Vasilio, dear friends. This was organized, or at least anchored, many months ago. And I thank them for bringing us here to the Palm Beach Civic Association. So I'll try to share with you a few words about Cleveland Clinic, in addition to what was already mentioned. These 4 gentlemen coming back from the World War I decided to do something completely different in healthcare, and they succeeded. They created an entity that worked essentially like a team, like a military unit. It was a novelty back in the days, and it was novelty because of its concept, and the concept was pretty unique. At Cleveland Clinic, we all work for the foundation. All of our profits get reinvested into the organization, research, and education. The second novelty is none of us, physicians, have a tenure. We are all on 1-year contracts. So I was privileged to renew my contracts now more than 20 times. I hope it's going to continue. You just never know. But that is another part of our tradition. And we are really, first and foremost, we are very focused on working as a team to deliver exceptional care. And this all comes to the realization that individual greatness is not sufficient any longer for our patients to receive really exceptional care. We have to have well-coordinated teams to work together. In our long-standing tradition, it's also reflected in our mission. Our mission has not really changed in over 100 years. We've just modified its wording somewhat. And we actually have a 3-part mission: caring for life, this is our clinical care; researching for health, We have one of the largest research infrastructures in the United States and in the world, and we have the second largest medical education program in the country, educating those who serve. While we are deeply, deeply rooted in Cleveland and Northeast Ohio, we managed to grow around the world. Here in Florida, we have a very steady presence and a very strong presence. We grew sevenfold over the last 8 years. And you will find out, we plan to continue to grow, in particular here in Palm Beach County. But internationally, Cleveland Clinic has a presence also in Toronto, in Canada. That's our first international expansion site. We have a very significant presence in the Middle East. Cleveland Clinic in Abu Dhabi is the largest hospital in the country, in the United Arab Emirates, and it is also the premier hospital in the entire greater region. We just celebrated 10-year anniversary. In London, Cleveland Clinic London, for those of you who know London well, is just across the street from the Buckingham Palace. So if, God forbid, you are our patient, or if you come to visit, one of the perks is that you can peek into His Majesty's gardens from your room. So it's in a 33 Grosvenor Place. And in addition to that, we have just acquired a neighboring building because of the tremendous demand for our services. We opened a hospital 3 years ago, and we're expanding into cancer care. And to go even further in the United Kingdom, our next destination is Oxford, England. We are collaborating with Larry Allison, who has built a gigantic research institute in the vicinity of Oxford University campus. It's Allison Institute of Technology, and Cleveland Clinic is partnering to establish clinical presence in Oxford as well. What is not depicted here are several more sites where we have expanded recently. We will be opening a new hospital in the heart of Asia, in Uzbekistan, in Tashkent, growing region with growing economy and stable governance. We have 3 new hospitals that we are overseeing in Vietnam, and we are also eyeing an opportunity to expand into Mexico City. So in aggregate, Cleveland Clinic has, as you can see here, more than 280. Actually, the exact count as we grow is more than 320 sites, 23 hospitals, and a gigantic footprint. For those who are in real estate, we have 35 million square feet of real estate to manage. So if anyone wants to take something off of our hands, we would welcome that. In addition to that, we do employ 83,000 people, and we're the largest employer in the state of Ohio by a wide margin, and we tend to be the largest employer in almost any community that we serve. As you probably saw, the recent employment reports in the United States, the employment that grew actually in 2 sectors. One was the real estate, and the other one was healthcare. And there is a good reason behind this, because healthcare has a phenomenal opportunity to grow. For those of you who visited us in Ohio, this is the depiction of our main campus. We essentially have several square miles of the surface in the east part of Cleveland, and we're planning to expand it very significantly with a large investment of probably north of $5 billion over the next 6 to 7 years. Cleveland Clinic, Conor and I are very passionate about it, so please forgive us. But what we are particularly passionate is not the size of the clinic, but the way that we work at Cleveland Clinic. Both of us came from different institutions and stayed at a clinic because of our culture, something that we call the Cleveland Clinic way. People are just exceptionally motivated to work together, so we always strive to serve our patients with a heart. We always work as a team, and with that we've been shaping the future of Cleveland, of not just Cleveland Clinic, but of healthcare for very, very many years. And what you can expect from us is not necessarily a perfection, because that doesn't exist in our line of work, but certainly a commitment to provide you here in Palm Beach with the best care available. Just to illustrate how quickly Cleveland Clinic has grown over the last several years in a patient encounters, it's even for us difficult to imagine. It's more than now 15 million patient encounters on an annual basis. Tremendous clinical activity, and you can see a very steep line of growth. We've been growing 10 to 12% over the last 8 to 9 years on the annual basis, so compound annual growth rate. What comes with this tremendous clinical activity is also financial results. This is the first year that Cleveland Clinic has crossed $18 billion in revenue. We are projecting to cross $20 billion in revenue next year. And none of what I just mentioned would be possible if we were not to have an extremely stable workforce. We strive to provide people who work at Cleveland Clinic with the best possible environment to work in. And I was just sharing here at the table, I got this job 9 years ago, and I was 54 at the time. And I was asked to recognize, that was my first task as the new CEO, a long-standing caregivers at Cleveland Clinic. So I got up on the stage and they gave me a piece of paper, and now I have to recognize somebody who had been at the Cleveland Clinic for 55 years. So I was speechless. I didn't know what to say to a person who joined the Cleveland Clinic before I was even in the plans, let alone that I was born. And this is not uncommon for Cleveland Clinic. We have people who spend decades and decades at Cleveland Clinic. With my 20-plus year tenure, I'm still considered relatively junior. And this is really a reflection of a growth in number and a complement of our caregivers. As I said, 83,000 caregivers worldwide, one of the lowest attrition rates in the industry, and extremely great satisfaction. And once again, a really important contribution for us to every community is not that we just bring healthcare, but we also bring well-paid jobs. So we continue to expand Cleveland Clinic globally. We're going to establish our presence here. We have been here in Palm Beach, but we are going to expand it very significantly. I would stop here and then actually ask Conor to join me here on the stage and speak in a greater detail about our plans here in Florida. I'll just flip through this so that not to steal your thunder here. There.
Well, thank you, Tom, and Mary, thank you for the introduction, and Catherine and Leo for the invitation. As Tom said, it's great to be here. I spent 20 years in Ohio, and I've been down here for the last 5 years, and very proud of what we are all building together as a team across our Florida market and the care that we're providing. And so what we've grown to, as Tom said, we've grown significantly across the world, across the US. But what we've grown to now in Florida is having 5 hospitals, and we're looking after close to 3 million patient encounters a year. And our team is a fraction of the enterprise team, but we have about 12,000 people working with us here in Florida. At the bottom, you see Cleveland Clinic Weston, so down near Fort Lauderdale. And that has been here, our presence is since 1988. And Weston opened in 2001. And Tom showed you the picture of our main campus in Ohio, where we both had practices, but it's a massive facility. What I can tell you, having been here, is that Weston is a microcosm of main campus. And the accolades and quality and outcomes and programs available at Weston are honestly not appreciated through Florida. Yes, it's the #1 hospital in the Southeast Florida market, but the outcomes and quality there are amazing. Just recently, our liver transplant program, so we even do heart and liver and kidney transplant programs at Weston. And just recently, the liver transplant program was recognized as having the best survival of any transplant program in the country. And that's the quality of care and the quality of the teams that we have. We were joined by the other hospitals, the Martin system, Martin North, Martin South, and Tradition in St. Lucie, so Stewart and St. Lucie counties, and also in Vero Beach, Cleveland Clinic, Indian River. Just before the pandemic in 2019, we realized that is a complicated time to do a hospital integration, going through a pandemic, but I can tell you as well that the quality of integration that we've seen since 2019, through a pandemic, through labor challenges, through hospital integration, is also amazing. These hospitals are doing fantastically, and I'll show you that in a little bit more detail in a moment. So Weston has a series of accolades, but as well as transplants, it's got a certified comprehensive stroke centre, absolutely, top quality stroke care, same for heart care, same for cancer. It's really providing outcomes that are equivalent to main campus and equivalent or better than many, if not all, hospitals, certainly in this region. It is a gem. The Treasure Coast hospitals have similar accolades, and what's been really impressive about what our organisation and Tom's leadership, one of the main things that we've done over the last few years is really standardise enterprise integration and operating models and standards. And that's allowed us get these hospitals up to what we recognise as a clinically acceptable standard. And normally when hospitals are acquired by a system, quality doesn't change. I can tell you that the quality at all of these hospitals has reached enterprise level, and probably above average actually, enterprise level across the organisation. So that's a testament to the quality of the people and the teams and the work. And Tradition Hospital, as an example, is now doing almost 900 strokes a year, has some of the best outcomes in the country, and recently was brought to California by Vizient, which is one of the rankers and raters nationally, and received, as Weston did, a national award for quality. So we're building an integrated academic healthcare system across Florida, and obviously Palm Beach County is our geographic gap in the middle of that, and that is the next phase of what we're doing. Tom mentioned the different parts of our mission, so research and education are very important. We have the training programs in Florida. We have research in Florida, so near our Tradition Hospital, this is what we lovingly call the FRIC, or our Florida Research and Innovation Center. And by partnering with the enterprise, we've been able to get an empty shell of a building up to this state with 100 team members, 24 NIH grants. So that means the science that you're doing and the care development that you're doing, because ultimately that's what it's about. Infectious disease and cancer being two of the focuses are absolutely top quality nationally, bringing in funding and research grants and publishing in absolutely top class papers. So this is really important because first, it's fulfilling all the different arms of our mission. Second, it allows us recruit really top talent. So we're not just getting somebody who wants to work in a community who may be awesome, but we can absolutely recruit top talent as well. So this has been a very important arm of the tactics that we've used to build and structure Florida. As an organization, we put a huge effort into community health. In Florida, our focuses are around food insecurity, behavioral health, and access to care. And I was chatting to Mary earlier, and I was saying that Tom and I just this morning were going around some of the underprivileged areas in West Palm Beach and already working on how we can integrate some of these themes around food insecurity, particularly, and safety and children and education into what we are doing for this county before we even have a hospital yet, and we're working on that too. So what about Palm Beach as a county and our West Palm Beach expansion? As you heard, we've had a presence here for more than 15 years. We currently have 30,000 square feet of space in downtown West Palm Beach in an outpatient facility. So that means we're not able to do emergency care or inpatient care, and we're limited in what we can do. But nevertheless, doing cancer care, infusions, imaging, primary care, and some cardiology and other specialties. But it's a small footprint, and it's not sustainable. So we've committed to phase one of our West Palm Beach expansion. And phase one you can actually see on the right. So that's on City Place. It's a building that Related Ross are building. It's a multi-story building that you can see on the right. And the white dots are around the 4 floors that we will occupy. And this is going to open in November of 2027. We've already committed the capital, the investment, the planning. We're recruiting people to fit into it, to expand the system that we have. And this alone is going to be a huge transformation for the county. So we'll be expanding the services that we offer, but the particular change is going to be that we're going to be able to do outpatient surgery. So much surgery as a surgeon can now be done as outpatient surgery. This alone is going to be a huge advance in the care that we can provide to the community and the breadth of care that we can provide to the community. On the left is the hospital or site at the moment. And again, with Steve Ross's support and generous philanthropic support, but also his local geographic support, we've been able to go through about 14 sites and have decided on this site, which you'll recognise from the map is on Australian, just north of Okeechobee, and these are the two current buildings that are there. So let me tell you a little bit about what we hope will be inside these. So first, the outpatient and surgery centre, as I mentioned, is going to expand that multi-specialty clinic. We'll have 77 exam rooms. That means we can have a significant number of physicians, providers and specialists providing care to the community. We'll be able to expand our imaging and labs and diagnostics. And as I said, it'll be 120,000 square feet with a separate entrance, valet parking, so access will be easy and high quality. And then particularly able to offer surgery. The hospital then that we're envisioning, and we are deep into planning this hospital. Detailed work has gone in on the services and the specialists and the space and the necessary components of care that we'll need to provide inpatient care and emergency care. So still going through this planning, but likely to open with 150 beds, with shelled 50 for about a 200 bed size campus, which is what you really need. That's very similar to Weston's campus, and as I mentioned, we're doing incredibly high-end care at Weston, with multiple operating rooms, particularly emergency bays. So we'll have emergency care. So stroke, heart attack, think of any emergency that you need. We will have that level of care here. Again, with teams who are running the same stroke protocols and heart protocols that we run at Weston, that we run at Tradition, that we run at main campus in Ohio. Very integrated. And this as well is going to allow us to expand our cancer provisions significantly, because we'll be able to add radiation therapy to the medical oncology that we're going to be providing in the outpatient centre. And so it's going to be close to 500,000 square feet in space. Some of the details yet to be refined, but we are 9 months into planning already. So I mentioned that the outpatient centre will open in November 2027. The hospital, we are planning and hoping that we can open it as soon as the end of 2029. So a little over about 4 years from now. We're investing capital, planning, people. We need your help. We need your help for some of the capital. So our goal is to raise 500 million. And with that 500 million, that will pay a component of the capital that we need to build the hospital, but allow us get this open in as soon as 4 years. So we are incredibly excited about the programs that we're bringing, the quality of the programs that we're bringing, in closing our geographic network of this scaled academic high-quality care network across Southeast Florida, and particularly in supporting the community here in Palm Beach County. And with that, we appreciate your interest and support, and we'd be happy to take questions to clarify anything that we've discussed.
Question. I was intrigued when you mentioned that healthcare was going to be the most aggressively growing industry, and I just wondered what your reasons are behind that statement.
I'm sorry, that healthcare which? I'm sorry?
Let me say it again.
There was an echo and I couldn't hear the sentence properly.
Problem.
I apologize.
I was intrigued by the comment made earlier this morning about the fact that the healthcare industry is the fastest growing industry globally, I guess. And so the question is, what exactly are your reasons for that?
Well, I think a couple of things, and Tom can provide more perspective, but one of the challenges healthcare has had for a long time is challenges with workforce and labor, and we've been short in many areas. And I think what Tom was alluding to is really that one of the growth areas in employment in the U.S. at the moment is in healthcare. So we're kind of backfilling some of those positions. The U.S. is about 1 million nurses short in healthcare. That's starting to stabilize. We're still 1 million short, but less turnover is happening. And then it's obviously such a good opportunity for people to work in. These are well-paid jobs. that we're seeing more people go into this. So some of the transitions we're seeing with other industries over the next few years are likely to help us. Tom, other perspectives?
No, yeah. So just purely from the employment perspective, in the United States, healthcare is the largest employer from all industrial verticals by a wide margin. We surpassed retail as the largest employer about 10 years ago. And that difference continues to be bigger and bigger. Several reasons for it. First is that insatiable appetite for healthcare. And most people feel that there is not a sufficient access to healthcare. They do not have enough healthcare. So there's a tremendous demand for the services that we provide. As Conor mentioned, there is also the shortage of labor. Millions of nurses are needed. More than 1 million nurses are needed in the United States. We produce only 100,000 produce. We educate only 100,000 nurses yearly in the United States. So a shortage is likely to be here for a long time. Shortage of physicians is very, very pronounced. So therefore, we do believe that we are going to continue to grow as an industry and as an employer. And the reason why I mentioned that in my remarks is because these are well-paying jobs in healthcare. So what we bring to the community are typically jobs that pay on average twice as much as an average income, household income in most communities that we serve, with the great stability of the workforce. And so those are those immeasurable contributions of having a larger healthcare system in your neighborhood. Sir, just...
We're very excited about you coming into the community. I was on the original board for Southeast Florida when you guys came into Broward County, and Broward County Hospital tried to stop you from coming in, and you've done a great job since. Here's my question to you. The cost of healthcare is seeming to go out of control, not necessarily the hospital's fault, but just as to what's happening in our country. Do you have any suggestions on what we could do to help reduce the cost so that the average person can afford, they don't have maybe the $5,000 or $10,000 deductible that's charged to put up to go into the hospital? Do you have any suggestions from that standpoint?
Yeah, I think I'm happy to speak about it because this is a question that at least I get asked wherever we speak publicly. It is really, really important to understand components of cost in healthcare. U.S. healthcare, 20% of U.S. healthcare cost, believe it or not, is administrative. So these are the claims that we need to file, denials that we need to deal with, unnecessary documentation. 20% of U.S. healthcare costs is related to administrative costs that contributes nothing to the actual care to the patient. Another really important thing that we in the United States, we're the only industry that pays for the products designed, invented, and produced in the United States, the price that is 2 to 3 times higher than the price that we sell those products outside of our own country. And I'm speaking about pharmaceutical and biotech products. The heart valve produced by Medtronic in Minnesota is being sold to us at the price that is 3 times higher than the price that the same valve gets sold to our colleagues in the United Kingdom. And that goes like that across the portfolio. Why is that? Because we do have a very fragmented provider market. We have 5,500 hospitals, each negotiate individually. Negotiating power is disproportionate. If you want to sell something to Germany or to the United Kingdom, you will be negotiating with the national healthcare system that has a substantially stronger negotiating power. And by the way, we can take it as a country because we are very wealthy. We do also pay 3 times the price for meds produced in the United Kingdom when they get imported into the United States. So those are kind of a big components, unnecessary components of healthcare cost. And typically people then look to people like Conor and myself to explain why is healthcare so important. But in a healthcare chain, if you're looking for the place where one can become more judicious when it comes to cost, you should have to take a look who in this healthcare chain makes the highest profits. It isn't hospitals. 40% of hospitals in the United States are not making any money. 40%. But then you can take a look at the margins of biomed, biotech, and pharma, and insurers, and those several orders of magnitude higher than the margins of hospitals. Yet, obviously, everybody's looking at us and the provider and say, why is everything so expensive? Why? Yeah, please.
Thank you for coming today, and we're very excited to have you come to our community. Can you talk about technological innovation, and specifically how you're thinking about addressing and implementing technological innovation, particularly with things like AI, but also even just computer-assisted procedures?
Yes, gladly. So what we are very, very much focused is on collaboration as a large healthcare system with the large technological companies to implement those innovations, in particular in the space of AI, quicker and quicker in a medical practice. All of that with the goal to provide better care at a lower price point and to more patients in need. So I'll highlight few companies that we've been working very closely in the AI space, and those are all by now household names, so you'll recognize them very quickly. We are the first healthcare organization that worked with Palantir as an AI provider to help us streamline our business operations. We run a relatively complex business taking care of 15 million patients with multiple service lines, and their AI products have helped us tremendously. We will be forming a joint venture with Oracle to create an innovative platform for AI-based delivery of primary care, which we are very, very excited about. We worked with pretty much every large digital company, including Microsoft, as well as Google, in order to bring the technology into healthcare at a much faster pace. So we are very, very excited about it. And I don't know, maybe you can speak about the Ambience as the newest AI application.
Yeah, I can talk about Ambience and maybe some of the device-based things that you may have been asking about as well. So Ambience is one of these large language model AI products that, well, when we think about all the IT systems we've integrated across the system, it's usually, people don't like change. Ambience is a product that effectively runs on a phone and will follow a conversation and translate it into notes in the electronic record. And obviously you get the patient's permission first. I can tell you it's remarkable. Patients with broken English, complex stories, difficult conversations, it pulls out the key components and it puts them into a note. So that helps the patient interaction. So the patients that's a direct conversation between people. And then it also helps us on the provider side because it reduces the burnout of having to go and type notes every night or finish notes at night. And we're now exploring looking at that for nursing and other things. And then just briefly, the technology in the hospital is going to be thinking of the hospital of the future, whether it's robotics for the supply chain side, robotics in the operating room, or just the technology that we need as we go into the future decades.
Yeah. Yes, sir.
A lot of healthcare in this market is delivered through concierge practices, small groups of doctors. How will Cleveland Clinic West Palm interact and integrate with those concierge doctors?
So extensively, actually, what people may not realize is how much of those relationships and how much integration we have already. So first, we have our own concierge team, which we're expanding across the entire Southeast Florida market. But second, we partner and work with many, many of the concierge doctors here on Palm Beach, throughout the county, and more broadly, and provide access for them for complex care to Weston, which is obviously the hospital that we have at the moment. So it'll become seamless, and we're already a resource for many of them.
Okay, yes. Whoever is distributing microphones, I'm sorry. Yes, please.
Thank you for your presentations and your wonderful hospitals and patient care. My question is a medical one for Dr. Mihaljevic. What are 5 medical advances for patients that you're most excited about?
Oh, five is a fair number, and it's still difficult to put in. What I'm mostly excited about is speaking about in general, and then I'll ask Conor to contribute from his area of expertise. I used to be a heart surgeon, so I'm a heart surgeon by profession. What I'm particularly excited is the advances in robotic technology. I'm biased. This is what I used to do. Robotic surgery, I think integration of robotic interfaces and artificial intelligence is offering a phenomenal promise, not just for heart surgery, but for surgery in general. What we are very excited about at Cleveland Clinic are advances in neurological care. I do not know if you've heard, but we are conducting the world's largest brain study, trying to unlock the mystery behind dementia and Alzheimer's. Right now, this is one of the biggest public healthcare threats that all of us are facing, yet we do not know who is at risk, we do not know how to diagnose it early, and we do not have effective ways to treat it. So at Cleveland Clinic, we're conducting the world's largest study involving 20,000 volunteers who have annual screening checkups and neurological and genetic analysis incorporated. And we have a very strong confidence that we're going to get much better when it comes to the treatment of neurological disease. We also in Cleveland, we're building, we open next year, the first and the only hospital in the United States dedicated solely to the treatment of neurological disease. That's how important that is for us. And then I'll stop on a third one, and then I'll turn it over to Conor. Obviously, advances in tailored, individualized cancer care are phenomenal. I think what we are seeing across different cancer entities, melanoma, speaking here, being in Palm Beach, this is a phenomenal threat that used to be a death sentence, not any longer. So we are very excited about the progress in that area as well. But Conor, you have.
Yeah, I'll just mention a couple of brief things, knowing there's other questions in the room, but just extending what Tom said, one of the things that we've done as an organization is have a quantum computer on site, and that's already designing new drugs and new agents for the future of personalized care. And the last thing I'd leave you with is not about one organ system, but really about the principle of care, and that's how we're making everything less invasive with quicker recovery, whether it's laparoscopic or robotic surgery, whether it's hips or knees or other replacements. And we're really revolutionizing recovery from intervention so people can recover more quickly with outpatient care, and that's transforming healthcare.
We're taking one more question.
From the nurse. Dr. Now, I wanted to do this correctly. Tom Mihaljevic, Doctor, and Dr. Delaney. I really wanted to hear from you today, and I heard something just astounding at this table. And that is that for 2 years, Weston Hospital, tell me if this is correct, has had 0 mortality rate. Is it in cardiac surgery or in transplant?
In transplant, in liver transplant.
That is a phenomenal statistic.
Yeah, it's got
yes.
the best survival of any program in the country. And while you're mentioning cardiac surgery, our Indian River Hospital cardiac surgery program had 0 mortality.
0.
But
I cannot begin to tell you.
Is remarkable.
In New York, now see, we don't know these things. In New York, which is where I practiced, and cardiac surgery was my most favorite, the mortality and morbidity rates are actually published. When I was in practice, it was every 2 years. Florida does not do that. New York does it by hospital and by surgeon, so that everyone knows what's up. And there's great concern in this community in two ways. If we have an MI, a heart attack, if we need cardiac surgery, we're concerned because where do we go? And yet you have this incredible statistic that we're just not aware of. And I really have to hand it to you because whatever you're doing in Weston, we need to know about it because it's all a buzz in this town. Where do we go if we have a stroke? What do we do if we have chest pain? Where's the best place for us to go so that we can have the full treatment of whatever we need, whether it's interventional or cardiac surgery. So I just wanted to make that point. I was really astounded. That's wonderful. Thank you.
Well, first, thank you on behalf Tom, myself, but particularly our teams, who are quite incredible. So, I think in the short term, if you're having a stroke or having central chest pain, you call 911, you go to the emergency room. It may not be the emergency room you prefer for a few years, and we end up getting many hospital transfers from some of the hospitals around here. And we're working on other transfer mechanisms to help provide emergency care. We're working on other transfer mechanisms as well. But right now, it's 911, you go to the closest emergency room, and then we can help you coordinate your care after that.
And maybe I'll just answer this was the last question with a little story behind the success of a liver transplant program at Weston. The person who carries really the credit for the success is a surgeon that we were able to recruit to Weston, who's actually Italian. Tony Pena is the best European transplant surgeon who used to work in Bologna, Italy. Then we recruited him into Cleveland Clinic Abu Dhabi. I had a chance to work with him there for about 3 to 5 years. Then he drank Cleveland Clinic Kool-Aid and never wanted to leave, but wanted to come a bit closer to Europe on a relative basis. He wanted to stay with Cleveland Clinic. So we recruited him from Cleveland Clinic Abu Dhabi to come to Florida. And he brought his team, developed our team. But the reason why I'm mentioning this story is that we are really blessed by being an organization that is present around the world, and we can recruit and retain a worldwide talent. So the world is our oyster when it comes to talent, and we're very, very blessed. And when we bring somebody like that into the organization, everybody benefits. So he's now Floridian. He's not, still looks Italian, but he's Floridian. And we're delighted to have him, and he's helped countless lives. You should have seen yesterday 3 or 4 families here from Florida who have typically children who've donated a part of their liver to their dying parents, and that partial liver transplant was done by Dr. Pena and his team. 0 mortality, perfect outcomes. That's the reason why we exist. So we plan to bring in here in Palm Beach, and we thank you very, very much for being with us today. Thank you.
We thank you both so much. We have gifts for you. We look forward to getting updates and certainly seeing the hospital come to fruition. So thank you.